1 in 6 people is affected by brain disease. That statistic led the AAN to head to Washington to host the AAN's inaugural Brain Health Summit and designate last September 15th as National Brain Health Day. Dr. Natalia Rost and David Evans are the architects of the AAN's Brain Health Initiative and join us here in studio to discuss what's next. Thanks to you both.
Thank you.
David, let's start with you. What is the Brain Health Initiative? What does it seek to do?
Yeah, so the Academy of Neurology Board of Directors in 2021 initiated the newest committee of the Academy, Committee on Public Engagement, or we like to use the acronym COPE, and with that our initial charge was our Brain Health Initiative. And although the Academy has been entrenched in brain health activities over the last 3 decades, we knew that we needed to unify and work with external stakeholders on a very bold initiative on brain health.
And we're dividing up the different stages or the areas of study into 5 different stages of life. Can you elaborate on that?
That is correct. We look at the brain health as it is a continuum from birth and until the last day of our lives. So brain needs to be taken care of along the lifespan, as we call it, individual lifespan, but also lifespan of the communities and global alliances as well. So we're looking at the fetal and child development, at adolescents, young adults, mature adults, and also people at the end of life whom we call our platinum cohort. Because at every stage of life, there may be somewhat of a variation on what does the brain health mean for the individual. And we make sure that we align our action plan along those epochs, life epochs. And so making sure that it's a continuum, we don't separate them into buckets, but we really think about it in a more comprehensive way.
As we mentioned, you had the National Brain Health Summit last September. You spoke with lawmakers, obviously trying to get a little bit more federal funding. There's always an additional need for more money. Where does neurology research rank in terms of federal funding?
So we really don't have a lot of the data. What we do know is that the discovery and research is outpacing the dollars that are available. Obviously in America, but all over the world, research is often siloed. And so we're working to act as conveners in this space to amplify research opportunities to advance brain health discovery.
So we could always use more.
We can always use more.
Absolutely. All right, and we know that the next Brain Health Summit is happening this fall. What do you want people to know? How can people who might want to get involved do so?
Well, they need to talk to us. First of all, Committee on Public Engagement is going to be the main think tank putting together the second Brain Health Summit. The first one, the inaugural, was an overwhelming success. We were very proud not only to bring a comprehensive program that focused on science, patient care, and also public advocacy in this space, but also plan a collaboration with a great group of what we call external to the Academy stakeholders, but really they are stakeholders in brain health across different medical subspecialties like psychiatry, as well as allied subspecialties like therapists and neuropsychologists, as well as the public, government, and also research funding agencies. So we're very excited to bring more people into our brain health tent, and we're also looking forward to invite collaborations with multiple sectors of the society. So stay tuned for our invites. We're going to be really looking forward for input, and we're going to be making sure that this is an enduring initiative.
And you'll both be heading to Washington come September.
We will be. We will be there leading a large group of neuroscience experts and public policy advocates, and working through our next stage of the Brain Health Summit, which is dedicated to collaboration.
Wonderful. Well, thank you both for all of your work on this. We all have brains, so we all appreciate it, and we certainly wish you the best of luck in the future. Thanks for your time today.
Thank you very much.